Hi, my name is Alison Roberts. I'm a clinical psychologist working here at CADAT, the Centre for Anxiety Disorders and Trauma. I work here mainly with people with OCD, which is an anxiety problem. Everybody in the population has thoughts, images, urges, doubts that pop into their mind from time to time, and those can sometimes be about things that are upsetting or random, things that they're not expecting to think about. The difference for people with OCD is that once that thought has popped into their mind, they tend to think that that means something significant about them as a person. So sometimes, for instance, if the thought is about something violent, or they can think that that means that they might be a dangerous person or a bad person, or if it's a thought about something harmful happening to somebody, they might think that they now have absolute responsibility to stop that happening. Obviously, once that thought process has occurred to them, they're going to feel anxious in that situation, and they want to do something to either reduce their anxiety or to stop the bad thing happening, whatever that is. Unfortunately, the things that people tend to do in those situations to try and reduce the anxiety or try and stop the bad thing happening tend to be things that feed the problem. So whether it's something physical like washing their hands, checking the door is locked, checking the gas is turned off, or something mental like ruminating about a situation or trying to suppress the thoughts, those actions that they take tend to be things that actually feed their anxiety and feed the belief that they could be a bad person or that they are responsible for preventing any possible harm. So they end up getting stuck in a vicious cycle of feeling anxious, trying to respond to that, but inadvertently feeding the problem instead of solving the problem. What happens then is that those things get in the way of day-to-day life. So it might be that they are late for work or not able to work because it takes them so long to get ready. It might get in the way of looking after things at home, doing the cooking, shopping, cleaning, etc. Or it might cause a lot of conflict or even breakdown of relationships with friends, family, children, etc. So for some people that can get to a very severe stage so that it can really quite significantly affect their lives. Here at the clinic we offer CBT, which is recommended in the NICE guidelines as the first line of treatment for OCD. And as a specialist clinic, we're very used to and very experienced in working with people with OCD, even at quite severe levels. So even if people have been for treatment before in other places where it hasn't been as successful as they would have liked, it's still worth coming to see us.